of your spine. Okay, so what are they? First is cervical, then thoracic, then lumbar, then sacral, then coccyx. So how many cervical? 7. Then thoracic 12, then lumbar 5. Out of this, first 4 is typical and the last one is atypical. Okay, so then this is the difference between the cervical, thoracic and lumbar. Okay, so see here, what is the difference? These three are looking like same, but this having some different characteristic features, okay, by which you can differentiate these parts. Okay, you see, this is your cervical. Okay, cervical is present mainly your neck region. Okay, so these things is discussed in your head and neck class. So this is your thoracic. What is the main function of the thoracic? It is attached to your sternum and ribs. Okay, and from the rib cage. Okay, and the lumbar is, they carry the upper body weight. Okay, so if any patient come like this, the backache, so mainly which bone is involved? Lumbar bone. Okay, and don't take photo. Okay, if you want you can write it down. Okay, so what is the differentiating features? So what is this part called? Okay, so in case of the cervical, see here, this is quite small as compared to your lumbar. Okay, always remember, if you go downwards, the size of the body is increasing. Okay, so the L5 lumbar vertebra, the size is more as compared to L1 to L4. Okay, so this is one characteristic features in the body. You all know the lumbar vertebra, the body are kidney shape or bean shape. Okay, and the anterior posterior diameter is less as compared to the transverse diameter. So transverse diameter is more. So by looking the body, in the cervical vertebra, the body is quite smaller. Okay, as compared to thoracic and lumbar. You all know the thoracic vertebra, the body is which shape? Heart shape, and the lumbar vertebra, it is kidney shape. So by looking only the body part, you can tell this is cervical, thoracic or lumbar. Another structure is, what is the structure? This is called which foramen? Yes, vertebral foramen. The vertebral foramen in case of lumbar and cervical, it is, see, what structure? Triangular in shape. Okay, so see, what is the difference? Cervical and lumbar both are triangular shape, but the cervical vertebra is quite larger, means the foramen are larger in case of the cervical vertebra, which is also the triangular in shape. But in case of the thoracic, it is, see, round shape. Okay, so this is the second characteristic feature by which you can differentiate the cervical, thoracic and lumbar. Next is, in the thoracic, you all know there are 3. What structure present? The facet present. Okay, here one transverse facet, there one superior inferior vertebral facet by which the ribs is attached. Okay, it is present only in the thoracic vertebra. This is absent in case of cervical and lumbar. Okay, in case of the lumbar, see here, this is your transverse process. Here one foramen is present. Okay, this is called foramen transversalis. This is only present in your cervical vertebra only. Okay, understood? Only the cervical vertebra, this foramen is present, but it is absent in case of thoracic and lumbar vertebra. So what are the 4 differentiating features? First is the body. In case of the cervical, it is small, okay, as compared to your thoracic and lumbar. In case of the thoracic, the body is heart shape, and in case of the lumbar, it is kidney shape. And the next is the foramen. The foramen is transverse or triangular in case of both the cervical and lumbar, but in case of the cervical, it is the quite larger as compared to your lumbar. Okay, the next is your the facet, costal facet. Okay, it is present in case of only the thoracic vertebra. Superior, inferior, transverse. 3 costal facets are present by which your ribs is attached. Okay. Next is your the foramen. This foramen is called your foramen transversalis. Okay, these things only present only in the cervical vertebra. This thing absent in case of the thoracic and lumbar. Okay, so if you want, you can write it down here. Only write the first four points. Okay, these things are not needed. Body, spinous process, vertebral foramen, then transverse process. So this is mainly the general features. Okay, examiner must ask. In case of vertebral column, always remember you can differentiate the bones. Okay, but in case of the upper limb and lower limb, you all know by looking the femur, you can tell that sir, this is the femur. But here this is similar only. So how you tell? By differentiating only. Okay. So first I differentiate between the three, like group A, B, C students. Okay. And now the L1 and L5. This is mainly the typical and atypical. Okay. So now these things are, suppose this is your group A, B, C. Okay. I only divide this group A, B, C. First differentiating. Then next, out of the cervical, which whatever things are differentiated means the particular group. Then now different. Okay, differentiating, which is typical and atypical. Okay. So you all know the differentiating features here. In case of your vertebral column or your ribs. Okay. Examiner must ask this differentiating points only. If you write only main things, the body of the cervical is quite small as compared to your thoracic and lumbar. In case of the thoracic, it is larger and heart shaped. And in the lumbar vertebra, it is kidney shaped and huge in type. And this is your spinous process. It is short. Oh, okay. Now another difference here, you can see this is your spinous process. Okay. See, this is your spinous process. Okay. In case of the cervical and thoracic, it is downward. Okay. Downward, posteriorly downward. But in case of the lumbar, it is quite straight and quadrilateral in shape. Okay. But in case of the cervical and thoracic, this is sharp and downward. Okay. In case of the vertebral foramen, you can write both are triangular, but in the cervical vertebra, it is quite larger as compared to your lumbar vertebra. And in case of the cervical, it bears the foramen. It is called foramen transversalis. But in case of the thoracic, here the costal facet is present. Okay. In the transverse process, costal facet is present here also, and here also. It is called superior inferior costal facet. This is transverse costal facet. And in case of the lumbar, there are no facets or foramen is present. It is thin and tapering in shape. Now you all know all those things. Only recap. Okay. So see, this is mainly the body. Okay. So the arch is formed by, how the arch is formed? Posterior part of the body. Okay. It is called your, this is the body. Okay. And this is your vertebral arch. Vertebral arch is formed by the posterior surface of the body. And this is your pedicle. This is pedicle. And this is your lamina. By fusion of these two. Okay. This whole together, it is called your vertebral arch. See, the vertebral arch of the two sides. Oh, okay. These things later. So first, remember, this is your body part and this is your arch part. Okay. Arch part is formed by your posterior surface of the body. Okay. Then this is your this pedicle and this is your lamina. Okay. Both sides this is present. So together it is called your vertebral arch. Okay. By together, it is from one foramen. It is called your this vertebral foramen. Okay. Now the different parts. Okay. Here you can see this notch is called superior vertebral notch. Okay. Another is inferior vertebral notch. Okay. So see, the superior vertebral notch is quite deeper because there are no attachment. But in the superior vertebral notch, here you can see attached your pedicle. Okay, that's why the inferior vertebral notch is quite deeper as compared to your superior vertebral notch. Okay. So next, see, This is your transverse process, okay, and below it, below or posteriorly, you can see another process is present. This is your accessory process, okay, and this is your, this two structure is called your superior articular facet, okay, which is directed, see, this is your concave in shape and directed backward and medially, okay, and this is your inferior articular facet, which is convex and directed, yes, forward and laterally, okay. Now you see in the posterior part of your superior articular facet, there are mammillary processes present, okay, and the distance between the superior articular facet is more as compared to the inferior articular facet. So these all things are your characteristic features of typical, okay. The size of the body increasing progressively, like the fifth lumbar vertebra, the body is huge, okay, as compared to your L1 to L4, okay. If you want, you can write it down, the main points I have written here. Then next, the length of the body. The length of the body anteriorly is more as compared to your posterior, okay. So you see the forward convexity, okay. You see now the curve, this curve, the body is present like this, okay. The lumbar vertebra are present like this, not straight, okay. Next is your vertebral arch, how it is from the posterior surface of the body, then the pedicle, then the lamina, okay, and this together by joining these two arch from your this foramen, it is called your vertebral foramen, okay. Then the processes, okay, first is transverse process, it is thin and tapering, okay, and posterior inferior part, you see one elevation is present, this is called your accessory process, okay. And in the spinous process, this is mainly quadrilateral in shape, okay, and it is thick and straight. And the superior articular facet, it is concave and directed backward medially, okay, and this is the superior inferior articular facet, which is convex and directed anterior laterally, okay. And behind the superior articular facet, this rough area, it is called your mammillary process. Now focus on the fifth lumbar vertebra, okay. So what is the difference? Okay, first difference is, see, the size of the body, okay. The size of the body is more in case of your fifth lumbar vertebra, okay. And you all know this is V-shaped structure, and anterior posterior diameter is less than the transverse diameter. So transverse diameter is more, okay. So now the main difference is here. First is the transverse process. See, focus on this transverse process. The transverse process here are not thin, okay. The transverse process are here, it is thick, okay, and pyramid in shape. See, this is the one features, main important features, okay. So this is the main important features. First is the transverse process, okay. Transverse process in case of the L1 to L4 means typical one, it is thin, but here it is thick and pyramidal shape, okay. See here another difference. Here you can see this is your pedicle, okay. Pedicle is attached directly to this transverse process, see here, or this pedicle is directly attached to your transverse process, here you can see, or the transverse process attached to the entire pedicle. See, this is your transverse process, this is your pedicle. The transverse process attached to your entire pedicle. If you see properly, you can see this is the transverse process, not directly attached to your pedicle. This is pedicle, okay. But here these things are directly attached, okay. So this is one features, important features, and the transverse process are thick and pyramid in shape, okay. And the next is spine. See, here you can see this spine is quadrangular in shape or quadrilateral in shape, but here it is not quadrilateral, it is quite small, and tip is rounded, okay. See, the tip is rounded in case of the fifth lumbar vertebra, okay. Next, the body, you all know, okay, the body is more. Then one thing, the superior articular facet, this is inferior articular facet. Always remember, the superior articular facet is present more backward than medially, okay. Previously this is togetherly same only, means the backward medially, but here this is see present more backward than medially, okay. And in case of the inferior articular facet, this is present more anteriorly or more forwardly as compared to your laterally, okay. So this is the another features, and one important features here, the inferior articular facets are means the distance between the inferior articular facet is more as compared to your distance between the superior articular facet. In case of the L1 to L4, the superior articular facets distance is more, but here the distance between the inferior articular facets is more. So this is the 5 differences by which you can tell this is your fifth lumbar vertebra. So tell me one by one. First is your body, okay. So body is quite larger as compared to your L4, okay. The next is your transverse process. Transverse process is pyramidal shape and thick, okay. And this is encloses your the pedicle, okay. The next, the spinous process. This spinous process is not quadrilateral. This is short, thick, and tip is circular, okay. The next is the distance between the inferior articular facet is more as compared to the distance between the superior articular facet, okay. And the superior articular facet is present more backwardly, and the inferior articular facet is present more anteriorly, okay. So this is the characteristic features, okay. Now you can write it down, the features of the atypical or fifth lumbar vertebra, okay. First one is the transverse process is thick, short, and pyramid in shape, okay. And their base is attached to the whole thickness of your pedicle and encroaches on the side of the body, or you can simply tell the transverse process attached to the entire pedicle, okay. The spine is small, short, and the tip is rounded, okay. Now these things is very important. The superior articular facets look more backward, okay. See, this is look more backward as compared to medially, okay. And the inferior articular facet look more anteriorly than laterally. And the inferior articular facet distance is similar to your similar, or the inferior articular facet distance is more as compared to your superior articular facet, okay. This is the main slide. If you read only this slide, you can tell the whole lumbar vertebra, okay, because here the main things are present. First is the size of the body in the typical lumbar vertebra is less as compared to your fifth, okay. Means the fifth lumbar vertebra is huge and the size is more, okay. Then next, the transverse process is thin and tapering, but in case of the atypical, the transverse process is thick, short, and pyramid in shape, okay. And it is attached the entire pedicle. The next, the spinous process is quadrilateral and thick. Here the spinous process is short, deep, and rounded, not quadrilateral. Then next, the superior articular facet distance is more as compared to the inferior articular facet, but in case of the atypical, the inferior articular facet distance is more. Then the superior articular facet directed backward and medially, and inferior articular facet directed forward and laterally, not medially, laterally. Inferior articular facet directed forward and laterally. But in case of the atypical, the superior articular facet present more posteriorly than medially, and the inferior articular facet is present more anteriorly than laterally, okay. So next is clinical anatomy, okay. So what is sacralization of the fifth lumbar vertebra? See here, this is the picture of the sacralization. Means L1, L2, L3, L4, but L5 is not seen here because the L5 is fused to your sacral vertebra. So this is called your sacralization of the fifth lumbar vertebra. So the fusion of the L5 vertebra completely or partly with your sacrum termed as the sacralization of the L5 vertebra. In many conditions, the transverse process of the L5 also articulate the ala of the sacrum or ilium and compress the L5 spinal nerve. Okay, because L5 spinal nerve are present below it now. So if this is fused, the L5 spinal nerve is compressed. So first is the sacralization of the fifth lumbar vertebra. Okay. Next is lumbarization of the S1 vertebra. Means, see here, the L1, L2, L3, L4, L5 present, but here another like lumbar vertebra, another vertebra is present. This is your S1 vertebra, but normally S1 to S5 are fused together. Okay, but here you can see this is behave like your lumbar vertebra only. So this is called your lumbarization of the S1 vertebra. See this line, the first sacral segment is loose and behave like another lumbar vertebra. So L1, L2, L3, L4, L5, but here this is the S1, but this is behave like your lumbar only. Okay, separately it is happened. So it is called your lumbarization of the S1 vertebra. So when the S1 vertebra is no longer joined with the rest of the sacrum, okay, instead it partly or completely fused to your L5 vertebra. So this is called your lumbarization of the S1 vertebra, and the symptoms like the backache. So sacralization of the fifth lumbar vertebra and the lumbarization of the S1 vertebra. Then next is Spina Bifida. It is mainly the congenital anomaly. What happens here? This is your vertebral arch. Okay, so this vertebral arch is not developed properly. Okay, this condition is called the Spina Bifida. So what are the complications? You all know, by your vertebral foramen, what structure passes? Spinal cord and meninges. Okay, so this is exposed directly and form hernia. Okay, so this is mainly the Spina Bifida. So it occurs due to the non-fusion of the two halves of the vertebral arch. In this condition, the meninges and the spinal cord are exposed and may herniate. See, this is the Spina Bifida. Means this is the vertebral arch. If it is not developed properly, the contents mainly the spinal cord and meninges are exposed directly, and this is herniated. So this condition is called Spina Bifida. This is mainly the congenital anomalies. Next is Spondylolysis. Lysis means breakdown. Okay, so which part is break? This is called your vertebral arch. Your body or vertebral arch is break. Okay, so these things happen normally, road traffic accidents also, or any type of injury. Okay, so in this condition there is a separation of the body of the fifth lumbar vertebra, okay, from this vertebral arch, or the vertebral arch is fracture. Okay, so separation of this body from your vertebral arch, this is called your spondylolysis. Okay. Next, this is the Spondylolisthesis. If it is a forward slipping of the fifth lumbar vertebra, is slip forwardly over the sacrum, this is called your Spondylolisthesis. Okay. Sometimes what's happened, the inferior articular process, lamina and spine of the L5 vertebra also separated from the rest of the vertebra. Okay, which is slip like this only, means forward slipping of the L5 vertebra over the sacrum. Okay, so this condition may clinically present at backache and pain radiating to along with your sciatic nerve. Okay, so this condition also called the sciatica. Simply you write, it is a forward slipping of the fifth lumbar vertebra over the sacrum. So this condition is called spondylolisthesis. This lumbar vertebra as clinical point of view very important, because the main function of is weight bearing of your upper parts. That's why. Okay. And many patients are come like your backache. Okay. This problem is more. So you all know anterior surface is more as compared to the posterior surface. So by which these things are happen. This is the curve. This curve is called lumbar lordosis. If it is occur more, so lumbar lordosis also occur more. Okay. Means the patient is bent like this. Okay. His back is bent like this. So this condition is called lumbar lordosis. So anterior convexity of the lumbar vertebra may get exaggerated and leading to your lumbar lordosis. Okay. Because the anterior surface diameter is more as compared to your posterior. Okay. By which this is curved structure. Means the lumbar vertebra is curved. So this is mainly happen the posterior laterally and presses the adjacent nerve. Okay. And see here, what is slip disc? A slip disc causes the sudden and severe lower back pain. Okay. So which part is called intervertebral disc? In between this part. If this part is bulged or herniated, okay. So this condition is happening. This is called slip disc or disc prolapse. So here the nerve root is compresses. Okay. So pain and tingling sensation of the leg and foot. Patients are coming like this. Okay. So the symptoms are mainly the backache, pain in the back. Okay. So surgery is the option if the conservative management is failed. Okay. So this is the slip disc or disc prolapse. These things are very important. You can read it in your medicine, surgery and all those topics also, all those subjects. Okay. So what is the lumbar puncture mainly? So a lumbar puncture is a spinal tap, is a procedure where a needle is inserted in the lower back to collect the CSF for diagnostic or the therapeutic function or inject medication. Okay. See how this means lumbar puncture needle is inserted in the lying position. This is the position, and in the sitting position, this is the patient is bent forward, then you give the lumbar puncture. So what is the space between the L3 to L4 or L4 to L5? Okay. So what are the layers? Your peers, then you can find the CSF, because CSF are present this subarachnoid spaces. Okay. So first is your skin. Okay. First is skin, then this is your subcutaneous tissue, then fat, then this is your supraspinous ligament, then interspinous ligament, this is the epidural space, then this is the dura mater, then arachnoid meter, then this is the subarachnoid space. Okay, this can be found in L3 and L4 vertebra, in between the L3 and L4 vertebra. So you crosses all those structures, then you can find this CSF. Okay. So this is the procedure of the lumbar puncture. Now from this slide you can write it down. The layers of the lumbar puncture means you crosses these layers. In the subarachnoid space the CSF is present. Okay. So first is skin, subcutaneous tissue and fat, then supraspinous ligament, interspinous ligament, then ligamentum flavum, epidural space, dura mater, subarachnoid, subdural space, then arachnoid mater, then subarachnoid space. And the site is important between the L3 and L4 or L4 or L5. So the needle is inserted in between the L3 and L4 and in between the L4 and L5. First you have to know what is lumbar puncture, then the layers which can pierce, then the site, then the indications. Means where you will give you this lumbar puncture. First is your meningitis and subarachnoid hemorrhage, then hydrocephalus, then CNS disease. Okay. In case of the spinal anesthesia, you heard about the spinal anesthesia, where it is given, which conditions? Mainly the LSCS, cesarean section, and your lower body, any kind of operation, these things are given. Okay. Spinal anesthesia. You bend patient like this and you insert and you crosses all those structures, then you can find the CSF. Here the spinal anesthesia also given. Okay, so now write what is lumbar puncture, then layer, then the site and the indications. So that's all about the today's class.